Hi, I'm Dr. Jyothi Raghuram, consultant pediatrician at Columbia Asia Hospital's Whitefield. Many mothers do feel that their baby cries excessively and are concerned if it is due to inadequate feeding or if there is something actually wrong with the baby. If weight gain is adequate, if baby is feeding well, and if baby is sleeping well for about a newborn baby should sleep about 22 hours in a day, and slowly the amount of sleep does decrease over time, then that would mean a normal crying and normal activity. However, some babies do cry excessively, which may be due to common problem like colic, infantile colic, when the crying is more in the evenings and at nights, and it can be easily taken care of by a medication to relieve the colic. Other conditions which may cause excessive crying are gastroesophageal reflux, when the baby brings out small amounts of milk or large amounts of milk after a feed, and that may be followed by crying due to the acid reflux, which may cause pain. In such cases, we see that the vomiting is significant, the weight gain is not adequate, and hence this would have to be evaluated by doing a test, and also can be taken care of by medication. In more serious cases, excessive and persistent crying may also indicate a problem in the brain, especially if baby has had any kind of trouble at the time of birth. However, in majority of cases, the excessive crying that we see is normal, it is physiological, and it is usually due to a simple problem such as a nose block or colic. And when we make sure that the examination of the baby is normal, the neonatal reflexes are normal, then we can reassure the parents that there is nothing to worry about. The baby may cry if he wants to be close to mother, if he wants to be picked up, if he is wet, if he has soiled himself, and these are the most common needs that a baby has, and of course hunger, which has to be addressed. So it is when we look at the baby's weight gain, when we look at the baby's examination, that we are actually able to talk to parents and tell them if this crying is normal or abnormal. If you find that your baby is easily satisfied after a feed, sleeps well, and for about 2 to 3 hours after a feed, then this would be normal. However, if a baby wakes up very quickly after feed, if the baby is crying and demanding for feeds even within half an hour to 1 hour, it may be due to inadequate feeding, and extra feeds may have to be given to the baby. If you do find persistent crying for more than half an hour or 1 hour, when the baby is inconsolable even after the common medications have been administered, then definitely you should take your baby to the nearest hospital.